As you have seen on the board, I'm going to discuss clinical anatomy of the mouth. There are several conditions or diseases that can affect the mouth. And one of the most common conditions that affect everybody, or virtually everybody, especially the people who don't care about the mouth hygiene, that's what we call mouth odor. This mouth odor is what we call halitosis. Halitosis is caused by several conditions or habits. For example, somebody who does smoke cigarette, he may likely have, or they mostly have mouth odor. That is halitosis. Similarly, somebody that has been infected with certain bacteria like Staphylococcus aureus, Streptococci, and so many other bacteria. And those one, in each part of our body, we do have what we call normal body flora. Those normal body flora, they are normally bacteria that are commensals to our own body. They are part of us, they benefit us, and they also benefit from us. So once you eat food and you don't rinse your mouth very well, the remnants of the food that you eat, that is a food to the bacteria that is inside your mouth. In the mouth, there are several species of microorganisms, be it bacteria, be it virus, be it protozoans, and so on and so forth. They are normal mouth flora. So, but they cannot cause any harm unless there are some, opportunity for them to do that. For example, if you allow food to stay in your mouth, so that is why it is good. Anytime after you eat, it's better for you to go and rinse or, clean your mouth with toothbrush or the toothpaste. You rinse it, or you do aswak, what we normally know in our own religion. That will definitely clear away the food particles, because it is the food that the animals, the bacteria, eat in the mouth. After they eat and get satisfied, they degrade the food and start releasing gases. I'm sure you know most of the gases in chemistry, what we call hydrogen sulfide. This hydrogen sulfide is a very nasty gas, very, very pungent smell. When you smell it, just like the smell of a feces, you understand? So that is why actually when you eat, immediately after eating, you go and make a brush of your mouth. That is the only way to be away from mouth odor. It is a very serious effect, a serious condition, especially for executive office holders like governors, commissioners, ministers. You see them, they are just having meetings. And once the people near them, they smell the mouth, they feel bad. Even among you people now, some of your friends, as you sit near them, when they speak, you have to turn your head away. It's very bad condition. As medical students or whatever, people should try to emulate how to do personal mouth or oral hygiene. That is the way people will take you as a very, respectable person. Somebody that has mouth odor, no matter who you are, people don't have any regard for you anymore because of what you have in the mouth. So you have to do personal hygiene to avoid, mouth odor. Apart from this that I've told you, trauma in the mouth, like when you drink very hot tea, the tea can now burn your mucosa. The oral mucosa can get burnt, and so you have burns in the mouth. That you give an opportunity for the bacteria inside to grow very well, because the blood vessels that have been exposed, they will be releasing some nutrients to the bacteria, and then that will be a sort of media for the bacteria to grow. And so the bacteria will be releasing this hydrogen sulfide in the mouth, and so the mouth will start making very pungent smell. Even you yourself, you will not like it. When you smell it yourself, you won't like it, talk less of your colleagues. You understand? Especially for the women, it is a very common cause of divorce in our environment. You marry your husband, the husband has a mouth odor. you will never love him. He will divorce him straight ahead. Or if it is you that has it, he will divorce you instantly. Within one day after marriage, he will divorce you. Unless if he loves you so much so that he can take you to clinic for oral cleansing. That is the only way to stay with you well. So that is one. Two, you may have what you call gingivitis. Gingivitis, you know, the gum can also get inflamed as a result of so many things, like the trauma. When somebody has an accident, the gum may get, injured, maybe by metals, by glasses, by so many things, or by sticks. When you are doing swag, when you are doing brush of your teeth, the rubber sticks of the brush can injure the gum, and that may make bacteria to go inside and cause what we call gingivitis at the area of the trauma of the gum. So gingivitis is just inflammation of the gum, and that can also cause halitosis. And that is why it is always good when you are brushing your teeth, you make sure that you rinse it or you brush it very well. You brush it, with care, so that you don't injure the gum, because the gum has a mucosal coverage. The oral mucosa covers the gum, and it's a very delicate membrane. So if you are brushing, you brush it very hard, it can injure that gum. Similarly, you may have what we call gum bleeding. The gum may be bleeding, and the bleeding may stop within a short period of time, or it may be continuous. You understand? And that may definitely also affect, the bacteria, conditions inside the mouth. So because the blood inside the mouth can be a media or a medium for the bacteria to also grow. And, it's not also not very good for one to be seen with blood along the teeth. When you speak, they see blood on the teeth as a result of gum bleeding. That one also shows that, your mouth is not all that. Lack of oral hygiene can also cause that oral bleeding, the gum bleeding, because the bacteria is going to grow and cause, fragility of the gum itself. You may also have the toothache. That is pain of the tooth or teeth. Is a single tooth or several teeth, you understand? So the teeth can get inflamed with any of the bacteria that are there in your mouth, or the bacteria that you swallow during eating. Because in the water that we drink, in the food that we eat, especially on the fruit, because the fruits that we eat, even though you wash, most often the washing is not all that very much effective. And so you carry along with the fruits the bacteria. And those ones, they can also cause toothache. The oral flora can also cause the toothache, depending on the way the tooth is, because the tooth can get traumatized as a result of our own habit. You get it? Like you are such a person that normally eat, biscuit bone or any kind of bone, So as you are trying to chew the bones, you tend to break some portion of the teeth or single tooth. You understand? And so that can cause the exposure of certain part of the tooth and can get infected. And similarly, the tooth may fall, especially for those of us that are good in taking chocolate. The chocolate is a very good culture medium for bacteria to grow because it contains sugar. The microorganisms, they like sugar. You understand? Just like the way we like sugar. So the bacteria will like chocolate. And so once you eat the chocolate after you finish eating the chocolate, you forget to brush your mouth. The sugar remnant will be a culture medium for the bacteria to grow. And so your mouth will continue to be smelling badly. You understand? So that is it. So that one, if it has become chronic, you always eat chocolate, you always leave the remnant in the mouth, the bacteria always grow there. And so it may cause what we call tooth, decay. The tooth may decay and cause a cavity there. And so that cavity created by the bacteria may definitely be a hiding place for multiple species of microorganisms. And so your mouth will always be smelling, always, no matter whatever you do, because there is a depot for that, there's a depot for that bacteria in there. Are you clear? So you may also have what we call glossitis. Glossitis is just like the inflammation of the tongue. The tongue can also be burnt when you eat very hot food or very hot tea. It can burn the tongue. And so the tongue, the mucosa of the tongue may be exposed. If it is torn or burnt, the microorganism can grow there and cause glossitis. Not only that, chemicals. At times we tend to take certain drinks or maybe very hot beer. I'm sure you know all this whiskey and so on and so forth. The whiskey, is very, very hot. If you take it now, it can burn your mouth, it can burn your tongue, whatever, if you are not used to it. I'm not sure whether some of you have tested it before. I know some of you might have tested it, and I don't know, in our environment, drinking alcohol is not allowed. Even in our own religion, it's not allowed. So I don't expect any one of you to, have tested it before. But for those who have tested it before, they know that it's very hot. It can burn your tongue, mucosa, and not only that, the trauma, during accident can also injure the mucosa of the tongue. And so the tongue can get inflamed by a superimposed bacterial infection or any other infection. That's also what we call tongue tie. The tongue, when you are asked to bring out your tongue like this, you are able to bring it out because it is free. But in tongue tie, the tongue is tied down the floor of the mouth, so that when you cannot use it to speak, you cannot speak well, because tongue is one of the most important organs of speech, and so you cannot speak well because the tongue is tied. And similarly, you may not be able to, if you're asked to bring the tongue out, you may not be able to bring it out because it is tied down to the floor of the mouth. That is a congenital kind of, condition. People are born with it, but it can be, it can be freed off the floor of the mouth by a surgeon. Surgeon can easily use a knife to cut, the frenulum that tie the tongue on the floor of the mouth. You can also have the tongue deviated to one side as a result of, injury to the hypoglossal nerve. You all know that the muscles of the tongue, both the intrinsic and extrinsic, are supplied by the hypoglossal nerve. That is the Towards cranial nerve. So the Towards cranial nerve supplies the muscles of the tongue, both the extrinsic and the intrinsic. So once this nerve is being damaged of one side, the tongue that is affected, the side of the tongue that is affected is going to be weak. So when you ask the person to bring out the tongue like this, bring it out, the tongue is going to be deviated towards the affected side, because the muscles of the tongue on that side of the nerve injury are weak. So since they are weak, the muscles, the normal side that is normal, the muscles there, they are strong. So when you are asked to bring the tongue out, the tongue muscles contract, and so they shift the weaker muscles toward that side. So that means it is the side that is affected, that is where the tongue is going to be deviated. So tongue deviation is as a result of hypoglossal nerve injury. Similarly, you may have cancer of the tongue, which is very rare, but it can happen. Cancer of the tongue is very, very serious, because once it affects the tongue, eating is going to be difficult, drinking is going to be difficult, speaking is going to be difficult, So you are just going to stay, without eating much, without drinking much. The mouth is going to be swollen. The tongue is going to be making some very bad smell because of the cancerous tongue, And so many places are going to be involved because of the metastasis of the cancer of the tongue. It happens actually, but it's very rare in our own environment. I've seen one case in my life. Throughout my life, I saw only one case as a doctor, maybe in the last 25 years or so. That was the time when I saw it last. Unfortunately, now I don't know the incidence of that cancer of the tongue. And we also have what we call cleft lip. The lip, either the upper lip or the lower lip, may have a cleft. That is a gap along the contour of the upper lip or of the lower lip. This is also congenital kind of abnormality. People are born with it. So the cleft lip may be associated with cleft palate. If you open your mouth, you put a finger, tip of your index finger, as the roof of your mouth. That is the hard, palate. And so that one can get gapped, during embryonic development. There may be a gap because, the palatine plates of the bones, there are two, one on the left, one on the right. So during the development, they tend to fuse in the middle line. So in case there is failure of fusion of these two bones in the middle line, there is going to be a gap in the middle line. That gap is what we call cleft palate. It may be through and through cleft, whereby you can have this extending up to the anterior part like this. So you may have, so in other words, the upper lip can also be gapped. So you have through and through cleft palate together with upper lip cleft. So you have a double cleft. All this cleft can be repaired by a surgeon. You get it? So you have seen cleft lip and the palate. You can also have what we call tonsillitis. Tonsillitis mostly affect young children or even the adult nowadays can get tonsil. You know what is tonsil? We have what we call palatine tonsil, and these palatine tonsils now they are, located. We have palatine tonsil. We have them in the mouth, and so once they get inflamed, they can cause difficulty in swallowing, because once they get enlarged, they may hinder swallowing. You understand? They may hinder swallowing, and they may hinder also speech. You get it? Because they are likely going to cover the oral, cavity. You understand? The entrance of the mouth, from the inside. So tonsillitis can also be cured either by antibiotics or maybe by, surgery. So they can get removed. These tonsils, we have the tonsils in the palate and what have you, and then we have the larger ones around the entrance of the oral cavity into the pharynx. And so they can be removed by surgeon, and the function of these tonsils is to prevent you from having frequent infections. Like I told you before, once we eat, in the fruit that we eat, in the food that we eat, or the water that we drink, there are some microorganisms inside them. And so the microorganisms, when they come into contact with these tonsils and what have you, since they contain some lymphocytes and what have you, they prevent the microorganism from getting, they prevent your own body from getting infected from the microorganisms inside your oral cavity. So they are important in the mouth, but they can get inflamed and they can be cured with antibiotic, or they can be removed by a surgeon. Similarly, there's what we call adenoids. Adenoids is nothing but excessive hypertrophy of the pharyngeal tonsils. We have in the pharynx, we also have tonsils, and those one can also get inflamed, and so they swell up and they may block the nasal, orifice from the inside. So that if you want to breathe in oxygen, there's definitely going to be a problem. So also if you want to also breathe with the mouth, because the adenoids now they tend to be large, you may also have some difficulty in breathing, especially the young children. But even as adult, actually, the condition is a little bit, far better than if it affects young children. You understand? So, but these are the things, the major things that one can, or I think you people should know with regard to the clinical anatomy of the mouth. You get it? So I will stop here, and then we have a break. And the next lecture, I'm going to discuss about the clinical anatomy of the ear.